We are hearing from California doctors that dealing with health insurance has become a big headache for them, to the point that patients are suffering as a result of it because getting approvals are getting harder and harder. My guest today is Dr. Hooman Melamed, who's a spine surgeon, who's in the middle of all of this and has been dealing with insurance and patient care. He's here to tell us how money making has become a core part of healthcare, and as a result of it, patient care is suffering. Make sure to share this episode with your doctor friends because a lot of them may face the same challenges, but not many come public with it. I'm Siama Korami. Welcome to California Insider. Hooman, it's great to have you on. Welcome.
Thank you very much for having me. It's a pleasure to be here.
You're a spine surgeon, and you're here to tell us there's a lot of trends in your industry, and you're concerned about some of them as a doctor, as a surgeon.
Insurance has become, extremely difficult. I've been doing now almost 20 years now. So I started in August of 2005, and I've seen the trend. In the past, you used to get an approval for surgery, no problem. They would approve the surgery right away, or the treatment. You want to go to MRI, you want to, anything. Doctors, it was the relationship between the doctor and the patient. So the insurance was there to help facilitate that. Now, you cannot get any approval hardly. You get rejected a lot right off the bat. You can't order MRI. You can't order CT. You can't get surgery approved. I've had to hire an extra person literally in my office now to help with doing appeal, calling the insurance, phone calls. It used to be very quick, like 10, 15. Now you could be on the phone 45 minutes to an hour on the phone holding. Transfer from this department, that department. They've created more roadblocks in order to get a treatment authorized for the patient. Now, the more expensive the treatment, the more roadblocks. Spine surgery, very expensive in general. So they have more and more roadblocks that they have put up, basically, to get this approved. So then you have to get on the phone with a doctor. I never hardly recall have to talk to a doctor to get my surgery approved. I was never accused of, you're doing the wrong surgery.
So they want you to talk to another doctor, or they want to talk to you?
They basically, we request, I said, I'm requesting, why you're not authorizing my surgery? They're like, okay, you can talk to one of our doctors. It's called peer review, peer-to-peer review. Two doctors talking about why I want to do the surgery and what is the medical justification for it. So now they have come up with guidelines. This is where it gets even bad. Doctors, you're supposed to help for the patients, not to help the insurance company. These doctors that are on the phone, I can totally tell they're not talking based on their experience or what. They're talking the guideline of the insurance companies. And a lot of times, these guidelines, sometimes they're flawed. They're based on very, very old information or not correct. There's a lot of literature that supports a different view. So I tell them, look, I have all this literature. I can't go based on that. Why not? Well, I have to go insurance company guideline. So then I say, well, what's the point of this doctor-to-doctor discussion if we can't discuss real evidence? I said, this evidence you're talking is from a decade ago. I have new emerging literature. One time, a doctor said, you know what, I'll get it to you. You know what, okay, you know what, you're right. I'm going to approve the surgery. I swear to God. Another one came up, and this same doctor came for another thing. I had to talk. I said, remember, you approved that for me. I swear to God. He said, I got in trouble for that. Wow. So it's become so frustrating. I'm not a volume guy. So it's not like I have so many patients I see in my clinic. Every patient for me counts, and it becomes very frustrating that I can't get my patients approved, and they're calling me, they're upset, and sometimes I don't have a choice. I just have to go to the emergency room. I have one today, right now. I have a patient in the emergency room today, right now. I had to send, because I know it's going to take weeks and weeks to get approval, and this patient can't. She saw me on Tuesday in tears, young lady, yoga teacher, neglected for 3 months, basically.
So the patient has pain? They come to you with the back pain?
Usually, most patients, what drives them to a doctor is pain. For spine surgery, it's usually some kind of a pain there, back pain, neck pain, shooting pain down their arm, shooting pain down their legs or something. It's some kind of a problem that somehow the patient Googles it, or their doctor, whoever they see a primary care, you have a spine problem. You need to go see a spine specialist. So that's how they end up coming. Most patients are now very educated. They go online, look at it. They have neck pain, that the pain shoots from the neck down the arm, from the back, shoots down. They know, they're educated enough to go see a spine surgeon. So that's how a lot of them come to me, word of mouth, basically. So they come to me, and it's very upsetting because I feel like you want to help them. These people are literally, I mean, they're in tears crying. They're not faking it. And then you call them, they don't care at all. Like they say, oh, you have to go through appeal, you have to do this, and finally, like this patient exactly today that I'm telling you, I'm going to be operating on her tomorrow. I said, you know what, don't worry, I'll take care of you, go to the ER. That's how we have to do it.
So you have to do the surgery through the ER.
Which is really bad because it's more expensive for the system overall.
So the patient has to say, you know what, this is an emergency, I have to go to ER, I can't do it. And then,
that's right.
And then they could get the surgery.
Yeah, I mean, this patient today said, what do I do when I said, tell the truth. I said, tell them the truth, how long you've been suffering, what is going on. Like, for example, their leg or their arm starts not working. They start getting weaker. Numb, weaker, like, hey, I can't use my hand, my foot is like, it's not coming up, And you tell that to the insurance, and they're like, well, the patient has to do 6 weeks of therapy first. I said, by the time they do it, it's too late, permanent nerve damage.
And what do the insurance companies require from you guys? So you have to justify, right? Before, did you have to do that, or
not
they
really,
would trust you guys?
No, they used to trust and stuff. But I get it. Listen, there's some doctors who do bad things. I totally get it. You got to protect. But they have the data. They have the data on every doctor. They can look to see, well, how is this doctor trending, basically, versus this other doctor? How's the patient's outcome? They know what happens after because they're the ones that are authorizing physical therapy after, narcotics after. So they know the data, and I feel like they're applying a blanket, basically, approach, not rewarding good doctors, but punishing everybody together under one umbrella for money, basically. And what's the impact on you as a doctor and other doctors?
It's so frustrating. I swear, this is one of the reasons that I talked to some of my good friends who were like, this is one of the reasons you want to quit medicine. Because you went in there to help people, and you feel like there's so many roadblocks. Like it really boils your blood. I mean, for me personally, it agitates me so much because now I have to sit down. I have to draft, like in the middle of clinic, I have to drop everything, go draft appeal letter. This patient's surgery was denied. Talk to the patient to calm him down, basically. Get on the phone with the doctor, and then you get more frustrated because this doctor doesn't care on the other side about what's going on with the patient, and it just ruins your day. I mean, it's like the stress that gets created, the emotional agony. Go like that. How much you can take?
In a sense, when you mentioned that these insurance companies should have the data, and can you tell us for us that may not know your space, how can somebody know what's a good surgeon and what's a surgeon that maybe not as ethical or as not doing as well?
That's very difficult. I'll be honest. I feel bad for the public because I do a third of my surgeries are revision. I fix other people's botched stuff. And it is very unfortunate because I feel the public trusts physicians. We look at physicians, at this high standard that they're going to do the right thing. And I do think there are some amazing, amazing physicians who they don't care about anything other than patient care. They don't care about money. They don't care free surgery, not get paid or not. They want to do the right thing for the patient. But unfortunately, just like any industry, there are bad physicians too who are there. I think patients should not just look at Google, but start getting references. Call the hospital, for example, where the doctor operates. Ask the hospital, the nurses station that the patients get admitted. That's a good place. The nurses will tell you the truth. How these patients, doctors, how many of the patients come back for repeat surgery? That's the thing. Patients don't know how many patients come back repeat surgery.
With the same doctor,
With the same surgeon, yeah. Listen, no surgeon has perfect results. I'll be the first one to tell you I absolutely don't have perfect results. I've had patients where I had to bring them back, no problem. But I'm talking about, listen, if you do everything by the book and quality is there, right? If the quality is there, patient doesn't have the best outcomes sometimes. Nobody can say, you should have done it this way, that way. Something doesn't go perfect. It's fine. But I'm talking about where you look at the post-op x-ray and you're like, wow, this
this was not done well at all. No wonder why the patient's coming back for repeat surgery. Or if you look at the schedule and you see the doctor did 8 surgeries in a day.
Wow. Is that
Yeah,
doable?
there are. How you do it, I've seen some of the doctors are doing concurrent overlapping surgeries. Patients don't know this. And I tell the patient, I said, I've done this for a decade. I've asked a lot of patients. I said, would you allow me to do 2 surgeries at the same time? They're like, what do you mean? I want to ask you, would you allow me, if you knew that I'm going to have another surgery going on at the same time, I'm going to go from one room to another room, and somebody else is going to be doing part of your surgery, are you okay with that? Not a single patient has said yes. Would you be okay with that, CMI?
No.
Of course not.
Nobody's such a sensitive thing because, especially spine surgery, if something goes wrong.
To me, this is not a volume surgery.
How many usually can you do per day?
So it depends on the type of the surgery, okay? It depends on which type of surgery. Let's say there's one big scoliosis, like a big major operation. The real amazing spine surgeons I know in the country, they would only do that one surgery for the day and that's it. They would not try to, because you know what? It's a big sensitive operation, big incision, lot of moving parts. They want to just focus on that one patient, do the perfect job. But some of these guys, they would schedule 2 or 3. They will do this room here, another room, another surgery, and then another one after, another one after. They're doing like 4 in a day. And of course, the results are not as good.
It's like a factory.
Exactly.
It's becoming a big business, right? Essentially.
Of course, the hospital is making a lot of money because they're allowing this overlapping surgery. So imagine one surgeon is basically generating 7, 8 surgeries for them in a day. Versus me, who in a day will do 2? Who's making more money?
So the hospitals like that too, in a sense.
I feel like they go along with it, basically. They kind of look the other way. My experience has been hospitals tend to favor people who generate a lot of money for the hospital. I've seen that.
Our sponsor today is Shenyun. There's been some negative press on Shenyun recently. Shenyun's mission is to revive ancient and traditional Chinese culture. Shenyun Performance started by a group of Falun Gong practitioners in New York. Falun Gong is a spiritual and religious group which believes in living by truth, compassion, and tolerance, putting others first. The Chinese Communist Party, CCP, has been persecuting it since July of 1999 in China. Since Shenyun started, CCP has been targeting it in the US and across the globe by playing different kinds of schemes to cancel the shows or impact the performance. The current negative reporting originated from some Chinese social media accounts. And we know that CCP is given a new directive to go after Shenyun and Falun Gong in the US by turning the public opinion against them. If you hear something negative on Shenyun, make sure to do your own research and your own due diligence. Despite all of CCP's campaigns against Shenyun, the show has managed to grow significantly across the world. I highly recommend you go see it. I've been going to it for the last 14 years as they change the performances every year. They're coming back to California. Make sure you go see it. So essentially what you're seeing, from what you're saying in your space, money has become the major factor.
That's what I'm challenged. I feel like the profit has become the most important thing, and we're losing sight of individual quality patient care, and also more aggressive surgeries. If you go look up, fusion operation, which is where you're putting rods and screws in patients, has gone up in the last decade significantly. There was an article, I don't remember where, maybe Wall Street, New York Times, I don't remember, but they talked about this, how number of fusion operation implant has gone up significantly. And that's where I have a problem with, because I feel most patients don't need fusion operation, and I feel like they're being pushed into that unknowing to the patient, basically. Patients do not know. Like literally, I saw 2 patients yesterday in my clinic. Both came to me, and they had seen each had seen 2 other spine surgeons. They both were told their lower back, they need fusion or artificial disc. Doesn't matter. It's some kind of implant-based surgery. And when they saw me, I said, you don't need that. You just need a little rotor-rooter, and I would inject your own PRP, your own bone marrow, inside your own disc. And they just looked at the shock. They're like, wow, that's not what I thought. I never even heard of it. I thought, I'm going to come here. You're going to tell me what the other guys told me. They're like, how come these guys didn't tell me? I said, I understand.
Is there more money in that?
Of course it is. So For spine surgery in general, if you divide it, basically the pay, usually it's very simple. You either are putting some kind of an implant in or no implants. So basically you're either doing some kind of a bony decompression, some little opening, what I call rotor-rooter, or you're putting some kind of a device in, some kind of screws, rods, or artificial disc implant in. The implant-based surgeries in general, on average, they pay 4 to 5 times more. Facility fee and for the surgeon on average.
So from what it looks like, there is a push to make money from doctors and hospitals to generate. And then the insurance companies on the other end don't want to pay.
Correct. So I get what they're trying to do, which I think, it's important to regulate, like to stop like bad practice of medicine too, but you have to reward good physicians, basically. You can't put everybody together. And poor patients are suffering, who are seeing the good physicians who want to do the right thing, but they can't get it done because these other guys are like ruining it for all.
And these are patients that have insurance, like normal insurance?
Yes.
Can you tell us more about just normal cases with individual insurance or corporate insurance?
The one thing I've seen, which I don't think it's fair, so they're all tiers, insurances, so depending. So if you're like the executive that has this very, very high-end corporate, high-level insurance or in Congress, everything gets approved right away. But lower tier ones, usually middle, like individual, like, lower tier ones, if they're like not what we call self-funded or fully funded, no, they put a lot of roadblocks. So it's like a VIP treatment. Think about it. It's like, it's like they say money talks. So if you're a corporate, you're paying that high dollar, yeah, your stuff gets approved right away. But other average common people, no, they don't get it, which I don't think it's fair. I think everybody should be treated the same, no matter whether you're Elon Musk or the guy that's barely making the minimum wage. I think health insurance should apply equally to everybody. The patient I just literally saw that came to my office on Tuesday, neglected for 3 months. I feel bad. She called my office. We came in, and my office knows. I try to do pro bono surgery, at least 1 or 2 pro bono surgeries per month, help people. I used to go, up until 2007, I used to go outside the United States and do free surgery. Then I was like, wait a minute. We have people here, they're not getting good care. I can help people here. Let me take care of our own people first, here. So I started doing more free surgeries here, which I'm helping more people than I would have gone if I would have gone abroad. So
because you don't have to spend the time and travel and all that.
Exactly. So you go there for a week, how many surgeries? But here I said, you know what, at least if I do at least minimum 1, if not 2 surgeries free a month, I'm doing at least 12 to 24 people, maybe more free surgeries a month, basically. A year, I'm sorry. So anyway, this patient, like Medi-Cal is one thing, which I think is terrible, because one of the things Obamacare did, they opened up Medi-Cal, especially in California. Like a lot of people got Medi-Cal, which is for low income, they're subsidized by the government. Now, Medi-Cal is not bad. They cover your basic needs, your basic OBGYN, like pediatric, your well checkups, your
like
preventive stuff here. But when it comes to specialist care, my God, these people are treated, I hate to say it, it's like a cattle, like a factory. They don't, and that's what really bothers me, okay? The doctor, if you have the Medi-Cal, they pay very little, which is fine, but you can't treat people based on insurance. You have to treat everybody equally. That's where I get upset, because I feel like the doctors who are Medi-Cal, they treat these people like a factory. Like this lady I told you.
Because they have to do a lot more to make the same money, right?
The same money, yes. So they're like,
because they get paid very little back.
Exactly. So they spend very little time with them. They treat them just not good. It's like a volume thing, the volume thing. And I was very upset when I heard like this shocking story. This poor lady, young lady, if she had a regular insurance, she would have had her surgery like 2 months ago, basically. She would have had the surgery, but she was neglected. They run around. She went to the ER at a hospital. And she was like, oh, no, you're fine. Go follow up with your thing, because she had Medi-Cal, get rid of it. That's another thing I found is like a lot of the hospitals, by law, they're supposed to take these Medi-Cal patients and take care of them because they're a nonprofit. But they don't. They're not doing what they're supposed to do based on their nonprofit status. They're supposed to I believe 25% of what they're supposed to take is supposed to be indigent, low income, Medi-Cal, but they don't. And nobody's looking into that. Anyway, this poor lady bouncing around. Somehow, I don't remember how she came to me. I saw her on Tuesday. I felt so awful for her. I told my office, let's start getting authorization. Then it's Medi-Cal. Like, oh, this is going to take weeks. This poor lady literally crying like her balls out in so much pain, like nobody cares. You feel bad. It's like a human being. I said, you know what? Don't worry about it. I'm going to do your surgery. If we can't get anywhere, I'm going to have you go to the emergency room. I was supposed to do her surgery this morning. There was a miscommunication with my office. Anyway, I spoke to her late last night. I said, you know what? Come to the ER today. I'm going to do your surgery tomorrow. Don't worry. He said, what about you? I said, don't worry about money. I'm not charging you anything. Don't worry about it. I'm going to take care of you. So I'm going to do her surgery tomorrow. And
when you do the ER, you just donate your time?
I just donate my time, yeah.
So you just tell them to go to ER, and then you just go there?
I just go there, yeah. She went in today, and then I'm going to go, do her surgery tomorrow, basically. I'm going to take care of her. I said, and I do that every so often, help patients who have no means. And that's what makes me very upset, because I feel like people are being very treated, not as a human being, some dignity, but they're looking at, this one has a good insurance, or not. I used to be somewhere. I swear to God, the place I used to be, one of the doctors, some of them I know, they look at insurance, what type of insurance the patient has. They get differential treatment. The first thing they look at is not who the patient is or what is wrong, what type of insurance they have.
Because the insurance companies will give them a hard time? Is that
not the hard time, but who makes more money? Like some of the insurances, they pay more money, so they treat patients based on that. Like, for example, like Medicare doesn't pay. Like, I remember where I used to be with this group, patients used to be in a waiting room. And I remember I was seeing my own group of patients, and a patient came and says, I don't understand. I've been sitting here 2 hours waiting to be seen. We're like, sir, who's your doctor? They said, my doctor is so-and-so. We're like, I'm sorry. We'll let them know. We have nothing to do with it. We're a separate practice. So in my office, I was sitting there. My medical assistant went to the doctors, told this patient. I heard the doctor said, you know what, I don't care. They have Medicare, they can wait another 2 hours. It's like free. I don't care. Get the other patient with a PPO in. I swear to God, this I heard it twice on 2 different patients.
Wow.
This is like, unfortunately, it's like this battle. I feel like insurance is not doing the right thing. Some of the doctors are not doing the right thing. So guess who suffers? The public suffers. The patients are suffering because they're not getting the good care. Their care is getting delayed, denied. It's a tragedy, and it's just getting worse and worse, basically, because nobody's looking into this.
When was the time when you realized things have changed?
I've been 20 years, so I would say about.
So you started as a surgeon right away, right? 20 years ago.
20 years ago. You come out, you're thinking everybody wants to help patients, do the right thing, and you don't pay attention. You kind of go along with it. And then once I started, I think about after Obamacare, about a couple years after, I started noticing the change. And I think when I feel like what the insurance companies start squeezing, I think that pushes people, doctors, to start doing things they're not supposed to do because they're trying to get paid more. Like, for example, they lowered the reimbursement. So guess what? You do more aggressive surgeries to keep making the same money.
Or do more surgeries.
And
lower your
exactly,
quality.
or push more patients into, I can begin to tell you, there are patients I see, I'm the second or third or fourth opinion. They come into me, they're ready to have surgery. I tell them, no surgery. They're like, what? I said, there was a lady, 75-year-old lady. She's like, what, doctor? My MRI shows me this. The 3 surgeons have said, I need to have surgery. I said, okay. What bothers you? What is bothering you? I have a little stiffness here. I said, is that all? That's all, right? Yeah. I said, you golf. I said, you ride your bike. I said, you go for a hike. You swim, right? You don't have any discomfort other than some stiffness. I said, yeah. I said, yeah. She said, yeah. I said, so why you want to do surgery? Because the doctor told me. I said, but look, think about it yourself for a second. You're not in danger. They're treating the MRI, not you. Basically. So that I see that too. A lot of patients are being told they're treating the imaging, not what's wrong with the patient. So for example, let's say I get an X-ray of your knee right now and it shows you have moderate arthritis, but you have no pain. Are you going to do a knee replacement?
It's so risky, right? This is such a big risk to take, and something could go wrong, right?
Yes.
And then there's the cost.
Yeah, I mean, I saw literally
But
a
there's a
patient.
push from the industry to.
Yes, the doctors, like, I feel like the reimbursement's going down, like the Medicare reimbursement's going down. It's unfortunately pushing doctors to start doing more surgeries, more aggressive surgeries to make up for this loss. And that, for sure, I've noticed the trend.
What do a neurosurgeon, a country artist, and a television and radio host have in common? They all saw the writing on the wall. Big banks sharing your financial information with big government. Join them as owners in Old Glory Bank, the pro-America online bank that protects your privacy, security, and liberty. Invest today at own.oldglorybank.com.
And before we get into how to fix this, Hooman, you're coming forward, and this is risky for you. Like usually people from your space, doctors, don't want to talk about this. Why are you doing this?
Because I saw my own dad go to jail. He believed in what he stood for. My dad used to be the Ministry of Health in Iran. It was a big position in Iran. And he went to jail because he was being forced to do something, to change some hospital rankings against his will, and he wouldn't do it. He would not give into it. They wanted to give him money. He said no. He was not corruptible, and I saw him. And when he went to jail, when they arrested him, they told him, all you have to do is to do this. Come out and make a statement. My dad was like, I'd rather rot in jail than to do what you guys, I'm not doing this. And finally, with public pressure, because he was the righteous man, after 4 months, they released, I saw him. And my dad, before I went to med school, I remember I was getting on the plane to go to my orientation for medical school. This is in '95. And my dad said, just remember 3 things about medicine. You're going to have 3 priorities in life. Number 1, patient care. Number 2, patient care. Number 3, patient care. You just remember that. And what I experienced in Iran when he went to jail, we used to go visit him, and what he said has always resonated. And when I start seeing things that I feel like they're absolutely wrong, I can't just look the other way. Like it boils my blood, because my dad was in charge of an ER, like the Mayo Clinic of the ERs in Tehran. He was Pars Hospital, and he was in charge of the ER, and he ran that place like everything was based about patient care, not money. Okay, you know what? You need to spend, I don't care. No, this is right for the patient. This is what we're doing. And I saw that. Everything was about patient care. So here, I feel like we've lost that. I think profit is becoming more important than patient care. So that's why I'm speaking out, and I'm hoping, and I have a mentor in residency, which I'm proud to share the name, Dr. Robert Miller, who I've talked to a lot. And he stood up for patient, and he always said, listen, we need more people he said watchdogs. He said, we need more watchdogs like you stand up. If you have more people like you, all this stuff is going to stop.
So do you think more doctors should come out and speak about what they see in their space?
Yes, we talk among each other privately, and people are afraid of retaliation. They don't want to speak out because they feel like their whole life could get ruined, and they can't. They can. If these guys want to ruin somebody, they can ruin somebody.
How would that be? Like you won't get reimbursements or like other
reimbursement? The hospitals will start, if you see something not right at the hospital will basically can initiate what's called a peer review against you. Like, oh, you did this wrong here, you did that wrong here, you know what? We're going to suspend you, you can't operate. And they're going to drag you through, you can go through a few years, 2 to 3 years up, you're suspended. You can't practice. If you can't practice medicine, how are you going to make money? You're done. That's why people are afraid. They don't speak up.
And you are not afraid of that?
No, because I feel like the truth, and you do the right thing. I think always, yes, you pay the price for it, which I have actually, but I can't, like, as I was talking to Dr. Miller actually a few weeks ago, I was telling him about some of my stuff. I said, do you think I should just be quiet and look the other way? He's like, no, you do not do that, because you have a soul. You know, how are you going to sleep? It's your conscience. That's why I can't.
And now, Hooman, how do you think, so I'm sure you have thought about ideas how we can fix this. Do you have any thoughts? What could be a fix to this situation you see?
I think the thing is that we have to start rewarding physicians in every specialty who have good patient outcome over years. That's not a difficult data. The insurance companies have the data. They know, for example, if a foot and ankle doctor or spine surgeon, let's use my field, you're doing the surgeries, okay, this guy, let me see, he's doing less invasive surgeries and less patients are coming back for repeat surgery.
So he's doing surgeries that are costing less, that are less extreme.
Yes.
And then they're getting less comebacks, less mistakes.
And less medications after, less narcotics after. They're recovering faster. So they're not basically using the system, oh, they need more therapy, they need more narcotics, they need more pain management. Like they're getting faster recovery. Like the surgery is working properly and the patient is coming doing better.
So if you have more narcotics afterwards, that's not a good sign.
Of course not.
It means the surgery wasn't that great.
You have to give somebody 90, like a simple surgery that you have to give them 90 pills of like Norco. There's something wrong with that, 90 pills. There's a good chance that patient's going to be addicted. There's 30-40% chance that patient's going to be addicted with 90 Norco. So I went, personally I was not satisfied with that. So in March of 2018, I started doing narcotic-free surgery. I said, you know what? This is not good enough. We need to start basically doing something about this opiate endemic that we have. So I started adopting a holistic approach where, I'm not treating your spine. I'm treating you as a whole, like your whole body. Because at the end of the day, whether you operate on a knee, hands, spine, doesn't matter. You're operating on a human being. What is the whole body is doing? Because if the body is falling apart, is not optimized, how do you think you're going to recover from the surgery? How are you going to recover from surgery? So I said, and with what was going on in our healthcare, with poor nutrition that we had, and obesity, diabetes, and this was really affecting outcome, basically. You can't ignore, no, I'm just focusing on your spine, I don't care. No, it doesn't work like that. So I started basically focusing on gut health, probiotics, educating the new patients on nutrition, important. I call it the anti-inflammatory diet, not weight loss. You could be skinny, you're still gonna get lecture. It's not about being skinny, overweight, it's about lowering inflammation in the body. So if you lower inflammation in the body, if you start basically treating people holistically, putting them on proper supplements and nutrition, guess what? Sometimes they actually heal. They don't need surgery, number one. Number two, if they need surgery, now they're optimized. And that's how you avoid basically narcotics and they get faster recovery, basically. So I have another patent pending approach, a cocktail I do during the surgery that I injected also at the time of the surgery. And that really helps the patients tremendously, very pain-free after, hardly requiring any pain pills after. We do give them some pain, but I give them Tylenol, I give them something like Celebrex, Lyrica, and very low-acting opiate is called Tramadol, and very few pills, and that's it. We don't give any more. Of course, there are exceptions. Once in a while, you have a patient, difficult, of course. But I will tell you, 90% of my patients, we don't give them Percocet, Oxy. We have to adopt, basically, as a surgeon, I think, start educating. Like, when I went to residency, all the focus was on orthopedic surgery, musculoskeletal and stuff. It was not focused on the total body, the gut health, the metabolism, your pancreas, your liver. This stuff is important. It makes a big difference. So I think we can start there by start getting people more healthier and educating patients, spending time with the patient. But that means you can't see 60 people in a day. You have to spend, my new patients, I spend 45 minutes to an hour. My office knows, they can tell this. My competitors, sometimes other people I know, they're seeing 60 people a day or 100 people. How can you spend quality time with a patient educating about all this if you're seeing 100 people a day? Listen, the insurance companies have the data. They know on their per month, this doctor is seeing this many patients. They know this. He's seeing this many patients. They know, okay, this doctor, let me see, they did 100 surgeries and, 70% was fusion. This doctor did 100 surgeries, 70% was non-fusion. Well, these guys are doing a lot better. They can easily start looking at this data. But the problem is that they pass the buck to the patients. So how they increase your premiums, your deductibles, every year goes up.
You mentioned that we have had guests on the show that actually become addicted after going to these operations.
Exactly.
They had an operation and then they actually went in and they took these pills and they liked it and
yes.
then they got addicted. Did you see that happening?
Absolutely. So that was the thing that was upsetting me because I feel like I was basically adopting what was taught to me with not default, but this is just, it gets passed on. Every residency you go through, this is just the way you do medicine, it gets passed on. Nobody's like critically thinking, well, is this really right to do it this way? So I started basically, one thing I remember I learned, and my dad used to say, is that never be satisfied with what you're doing, even if it's going well. Always try to figure out, could this be better? If you don't think like that, how are you going to get better? So I was always thinking, like, okay, can I do the surgery better? Can I treat the patient better? So I started thinking, always getting better. And then about 2013, I got introduced to this whole branch of medicine called functional medicine, basically, integrated functional medicine, where it looks at the human body as a whole. None of that was taught in medical schools. They don't teach that stuff. They're teaching you how to push drugs. You have high cholesterol, here's a drug. You have hypertension, blood pressure, here's a drug. You have autoimmune, here's a drug for it. But why do you have high cholesterol? Why do you have... It
doesn't get to the root cause.
The root cause. So I learned these guys and the root cause and why we have higher cancer, we have higher chronic diseases, neurodegenerative disorders. Like, it's getting bigger and bigger, and we're spending the most highest dollar than any other place in the world. We're getting worse and worse. So these functional doctors are dialing it back and treating the patient holistically by using food as medicine. I was becoming pre-diabetic. If you looked at me at the time, I was less than 10% body fat. People knew I was amazing shape, but I was pre-diabetic. You wouldn't believe that. I had cholesterol was like going like crazy. I had acid reflux. So my friends, here's a bunch of pills. And
so your doctor friends would
Yeah. They're like, you got to just do cholesterol, you got to do. And I'm like, There was a colleague, a friend of mine, Dr. Tazib, Rochelle Tazib, T-A-H-Z-I-B, which I credit her, with really opening my eyes. And when I talked to her, I was like, I've never heard of this. What is she talking about? So I started reading a little bit, and I started attending conferences. And I actually went to her, said, you know what, let me see if she can. And I went to her. She got rid of all of my problems by just using food and supplements as medicine, basically. And I couldn't believe it. Everybody was like, it's not going to work, dude. And that's how I learned in med school. Everybody was like, you can't lower your cholesterol by 50%. That's impossible. You need to have, this is just life. You get older. But no, I learned from her, and I started adopting that practice, started incorporating it into my own practice. And I saw the results where if you treat patients holistically the way I did, it makes a big difference. Like, the patients are like happier, less pain, much faster recovery. But this stuff takes time. You got to sit down. The problem is the insurance companies do not recognize any of these extra work, basically. They're not reimbursable.
So the doctors are just treated the same. It
Yes.
doesn't really matter if you do 8 surgeries a day and you kind of look at it as a factory,
Yes.
or you do one really good one and you really care about that patient, or 2 good ones.
They don't care. They don't care about that. It's unfortunately, to me, it's like if a guy came out, I had a patient who was a nurse, actually, and very well, highly skilled nurse that she's been in administration right now. She came to me, she wanted surgery. Her insurance had no out-of-network benefits. And they treat us like commodity because she wanted me to do the surgery based on what she heard, whatever and stuff. The insurance company basically were trying to send her to a guy who just finished training 6 months ago to do a big, complex surgery. Like, if it's your spine, do you want a guy who just finished fellowship a year ago, 2 years ago? Or you want them to go to somebody who's experienced with a very good track record to do a very complex surgery? Because I've seen the results that a bad spine surgery can ruin someone's life.
Can you become paralyzed, right? Is that or
No, it's not even just paralysis. That's the extreme, but it's more like chronic pain. Like, you get dependent on opiates. Like, your quality of life is ruined, basically. You're in just pain. You can't stand up straight. You're basically hunched over. You're in so much pain. Like, it just ruins your life. They treat you rather than saying, you know what, this guy. So I had to get on a call with a doctor. Thank God the doctor, he actually was good. He said, you know what, this is a no-brainer. I'm going to approve the patient to have surgery with you. Everything you're telling me makes sense. I get it. You know what, no. That's it, approval. But the insurance was pushing the patient because I saw the name of the doctors they gave, and I'm like, None of these doctors have more than 2 years of experience doing this. Because to them, it's not about the money because they can pay their in-network doctor very little money. Unfortunately, the hospitals, the healthcare, I feel like doctors who are getting good, they don't reward them, so they leave. So then they have a lot of the hospitals, the corporations now, healthcare, they hire these young, super young doctors. So if you go look at a lot of the hospitals, big hospitals, there are different departments, you'll see a couple of really good doctors who are very good. The rest of them are all these super young people because they don't want to pay them. And 95% of the public doesn't really have access to those really good doctors because those doctors only treat royalty or super VIP. They're only so much time they have. Everybody else gets stuck with these guys, with the minions.
Now, do you have any recommendations for the patients?
To me, is doctor experience matters. I can tell you what I know now. Experience really makes a difference. It's not about your skills. Even if you have the best skills, you come out, you don't have experience. And I've learned in spine surgery, experience really matters. So find out the experience. How many cases of these have they done? Call the hospital, talk to the nurses station that know. The nurses know all the doctors who are doing the surgery, spine surgery. They know all the spine surgery. They will tell you who they would go to. Call the nurses. Ask references. Say, I want to talk to 5 patients. Also, don't just look at a 5-star Google review or 2.5-star Google review. Read the reviews, because sometimes I know a doctor who has like 2-star Google review, but none of the reviews are about him as a doctor. It's about his office staff. It's like terrible. So that's not fair to the doctor. Read this stuff. I say get references. Get multiple references, basically. And especially, I think if you're being offered a big operation, fusion operation, you know what? Get another opinion. Don't just jump into it. Find out if there are alternatives that can be done. Alternative surgeries. Sometimes patients are not told that. Get a second opinion. Put the brakes on. And I tell you, another thing, don't always listen to fear-mongering. I've had patients who've been told, if you don't have surgery in 48 hours, you're going to be paralyzed, which is not true. It's wrong. Sure, super small percentage of the population, yes, you need emergency surgery, no problem, but not every patient. If you don't have any ongoing bad nerve damage going on, meaning if your arm is working, your foot is working, your leg is, you don't have that much weakness, you don't have that much numbness, you're not in danger, okay? You have time to get a week to get other opinions. Don't, if a doctor is really pushing you, and just listen to your body, get second opinion, third opinion if you have to, especially the bigger the surgeries. Ask the doctor, I need to talk to 5 of your patients. And ask question. Listen, the doctor's job is to sit down. You know what I do when I finish? I never come and talk whatever I leave. I always, at the end, I say, do you have any other questions? Listen, there are sometimes patients, I get it. They're asking the same question repeatedly, but I never tell the patient, okay, enough, whatever. Or, you know what, I got to go see, let the patient basically you know what, no, I don't have any other questions. Thanks. Okay. But if you're seeing there, ask the assistant or the medical assistant, how many surgery does he do a week? If they say he's doing 15, 20 surgeries a week, that's a red flag. Does he ever, how many surgeries he does in a day? Because spine surgery, I remember my mentor told me that if you can do 6 or 7 really good surgeries, but do a really good job, that's very good.
6 per week? Or?
6 a week, yeah. 6 or 7 a week, and you can do the job really well, focus on that. You don't need to do any more. You don't need to do more than that. More than that, depends. Listen, if there's I've done sometimes 9 in a week, but they're little 1.5 hour surgeries, you would do 3 of them in a day, 3 of them in a day, 3 of them in a day. So that's no problem. But I'm talking the spinal fusions where they're taking longer, and you can ask him, how many fusions is he doing basically? If they're doing a high volume surgery, these are the things to do. How many patients does he see in clinic? If they're telling you, we see about 50, 60 people a day in clinic, that's a red flag. From 8 to 5, really can see 60 people and give them quality? How many minutes are you spending per patient? These are the things, basically. But patients have to be proactive, ask questions, don't feel like you're rushed, basically. You shouldn't feel rushed.
We have heard from some doctors that the problem in the healthcare is a lot of patients have no idea what's the cost.
Yes.
They don't know what costs what. They will find out afterwards. You might
get a surprise bill.
You either get a surprise bill or your insurance will pay for it. So you might have gone through a surgery that costs 5 times more. Somebody could come and see one doctor and pay double the other doctor, or go to a hospital that costs like 5 times more, another one. Do you think this is a big factor that's causing a lot of these problems in the healthcare, or do you think there is a way to solve this?
I think some, yes, because by law, all hospitals were supposed to put on their website the transparency law. It was a law that was passed a few years ago, the transparency law. The hospital is supposed to publish exact amount they're charging for every surgery. But unfortunately, that hasn't happened. And nobody is holding hospitals accountable for that. Hey, this is a law, you're not doing it. Some hospitals are, they're not doing it. And yes, you could go one hospital that says an appendectomy, let's say your appendix out. One hospital will say 10,000, another hospital says 60,000. Or knee replacement. One hospital says 15,000, another hospital says 80,000. Same exact surgery, basically. So to me, part of the problem is also the bigger the hospital, the corporate, they tend to charge more because they have a lot of patients, because the bigger the corporation, the big name hospitals, they tend to command more from the insurance company. So for example, a simple, let's say, appendectomy, one hospital could get paid because of their contract, could get paid, let's say, 10,000. Another hospital for the same surgery is going to get paid 50,000 from the same insurance company.
From the same insurance company?
Yeah, so doesn't matter, Aetna, United, Blue Cross, doesn't matter. Same insurance is going to pay one hospital this much, another because of the contracting, because of the power one hospital has. So that's how I feel healthcare costs increasing, because when these bigger hospitals are charging this much, and then eventually they're starting to buy out all the little guys. So now, for example, a freestanding healthcare facility, imaging. There was a place I knew, I used to send my patients, if they needed cash, $150 for a CT scan. Now, they got bought out by a major hospital, basically. So now the cash price for that is like $450. Same CT, same tech, same everything, no difference. Because they commanded
three times the price.
So the reimbursement now for the same imaging, because I remember I talked to the radiologist, I'm like, hey, why did you guys merge it? They're like, yeah, the reimbursement, simply. So now because they bring their contract, so now the same thing is being paid 3 times, 4 times more.
Because the insurance is paying for it, right?
Exactly.
Or they have a better deal with the insurance.
They have a better deal, they have a better contract. So this is our contract, you need to pay. And unfortunately, the insurance companies, when they get squeezed, ultimately they squeeze, the consumer, the patients, basically.
They either charge more or they might not approve the...
Or approve it, yes. That's exactly right. I mean, we know they charge more because, our premiums have gone up. The premiums have gone up every year. And part of the problem, is there's also a monopoly that's happening with the insurance industry in different counties and states. Before Obamacare, we used to have, I could go as an individual and look at the list. I'm like, okay, you know what I want to get, for example, I want to get this one here. And you know what, the premium was, I remember the premium at the time was like $200. And I had amazing insurance. My deductible was less than $2,500. And I could go to anywhere in the country, get it done. When Obamacare came, guess what? You don't have a list anymore. You only have one major insurance individually in California that 90% can only get. That's all you get. So now they know I have the monopoly. They can also control that, deny, because you don't have you don't have any other choice, basically. So now they can increase your premium. Like my premium every year is going up. Deductibles get a little bit more. Copay increases. Copay used to be 10, 20. Now it's like, 50, 60, 70, 80. It's going up basically for the same thing. Because I get it. The insurance companies are getting squeezed because the hospitals are charging more. They've created a monopoly. It's like this kind of a system where the hospitals and the insurances profit is like basically becoming the center point for all of them. So one squeezes the other one squeezes around the patients, basically.
Dr. Hooman Melamed, orthopedic spine surgeon, it was great to have you on California Insider.
Thank you very much. It was a pleasure. I loved it. Thank you very much.
Let us know what you think of this conversation with Dr. Melamed. Do you think the healthcare system has become more about money than patient care? You can always reach out to me by emailing me at siamak@californiainsider.com or make sure to comment. We read all of your emails and comments. We'll see you next time.